Thank you very much for the kind invitation to this very, very interesting Congress. I hope my English is understandable for everyone. I understood that I was introduced already. I'm a classical homeopath, and beside that, I'm an obstetrician and I'm a gynecologist. And I do all kinds of gynecologists. I'm a surgeon as well as a homeopath. So I'm kind of a bridge builder between the homeopathic world and between the conventional medical world. And this is also how it should work, because I wouldn't want to be an obstetrician and gynecologist without having the possibility to treat my patients also homeopathically, because I can choose in each patient what is the thing she really needs. Can I do it with homeopathy, or do I need conventional medicine, or have I to do it with a combination of both of it? So what we do in classical homeopathy is we treat, on the one hand, acute diseases. Acute diseases, in my cases, are very often life-threatening incidences. A postpartum hemorrhage, for instance, is a life-threatening incident we have to deal with very fast. Everything that goes on in labor and delivery room and with childbirth, acutely with childbirth, is an acute disease and needs very reliable remedies to deal with them, and it needs rather high skills. But acute diseases can be learned to treat homeopathically rather easy. The second part that we do is chronic diseases, like, for instance, infertility, endometriosis, chronic pelvic diseases, whatever. And this is not easy to be learned homeopathically. You have to study homeopathy like you study and go to medical school. And if you have these skills, you can deal with a lot of these things also homeopathically. Both of them, the homeopathic approach with chronic diseases as well as with acute diseases, are highly effective if you know what you do. It is not the question, does homeopathy work? It is always the question, does the doctor who uses it know enough and is skilled enough and learned enough in homeopathy to use the right remedies? We have a range of about 2,500 homeopathic remedies, and we use maybe around 800 more frequently of them, and we have to know our remedies, and we have to know when it is safe to use them and when we'd better go on to do conventional medicine. Disease in the homeopathic approach, like I heard already before, also in the other alternative approaches, is not something that comes out of thin air. Disease is not here unless we break our leg, then it is just here, but otherwise not. Disease, there is always a trigger for a disease, and there is a pathway into the disease, and there is always an exit route. So at some point, the homeopathic approach stops the disease so that it would not go on to chronify and chronify itself. A very typical way of the understanding how homeopaths understand disease is the typical atopic problem. So we have, for instance, a child with dermatitis, skin eruptions. What we do usually in conventional medicine, we give corticosteroids, the skin eruption goes away. As we all know that we never can cure with corticosteroids the source of the disease. It is like cosmetics. I've got bad skin, I put makeup on, no one sees the bad skin. In the evening, I wash the makeup off, the bad skin is there. This is what corticosteroids usually, not always, but usually do in skin diseases. And the problem is that after you administer corticosteroids for a while, the child will go into allergies. It will become more and more allergies. So what do? We give more corticosteroids, we give antihistamines, and in the end, the child develops asthma, or the grown-up then later develops asthma. This is the typical approach we see. And our homeopathic approach is completely different. We say, first thing we have to know is the source. When did the disease start? Why did it start? Even if it is 10, 20, 30 years ago, we have to find that out. Because our remedies work with the source. When I know, for instance, that a child started with an asthma after a skin eruption was cured and after, for instance, his mother died, then I've got a psychological source why it suddenly turned into even a more severe disease. And we've got homeopathic remedies to heal that. So as we heard at first, we've got a holistic approach. It is not just about the body. We are a full whole of body, spirit, mind, psychology, and body, psyche and soma. And we only can really heal a patient, and our goal in homeopathy is we do not just want to help someone in the moment, it is always about healing as long as we can. And to see this, we have to see the patient as a whole, from the psychic side, from the somatic side. So, what do? We use homeopathic remedies after we did a very careful exploration of the case and found out when disease changed into what kind of disease. We administer our homeopathic remedy, and then what we see is there is a law of healing that works in everyone the same way. The healing, we call it the Hering's Law, after a famous homeopath who lived around 1900. We see it always, the healing works from the upper side to the downside of the body. This means if you've got a skin eruption on throat and face, and you give a homeopathic remedy, and you see that that skin eruption starts to go down, it walks down the body, it clears up in the face, goes down, you know you're on the right path with what you're doing with your patient. The second is it always goes from inwards to outwards. So the typical thing that happens, the asthma first goes away, but then the skin eruption comes up again in the body. And the other thing is that more important organs always are relieved at first by the homeopathic remedy, and the disease goes to the outer part, to the less important organs. Like asthma goes away, the lungs are safe again, the bronchi are safe again, but the skin eruption will return on the outer part of the skin. It's unpleasant, but it is not life-threatening anymore. And in the reverse way of their coming. This means first the asthma goes away, then the allergies goes away, and at last the skin will heal up, and then the patient is healthy. And this we can watch in all the diseases we treat in chronic cases. The man who was the founder of homeopathy was Samuel Hahnemann, a German physician and a polymath. And what he saw is, he was at this time, one of the most learned men there was, I guess, in the European world, because he translated all the until 1800 known medical scripts into German. So we got an overview from the antique French, English, Latin, everything we had about the medical standards there were in the different times and that existed then. And he watched something. What he watched was that already Paracelsus and Hippocrates found out that very often you can heal a disease by giving the same thing. For instance, frostbites, you must never heal with warmth. If you heal it with warmth, the patient is lost. But if you have a patient with frostbites and you put them into snow and ice and cool them, then slowly it will recover. Or he saw, for instance, that there is a herb named Hyoscyamus that grows on the hills outside villages. If people if they are toxic themselves with Hyoscyamus, what happens is they go into a rage. They are loud, they are rude, they rip off their clothes, they yell at people, they are completely out of their mind. And if you brew a tea out of that and give it to people with exactly this typical way of madness, as they called it in the old days, he will soothe down and become calm. All these things he learned by translating those old literatures, and saw there might be a rule of healing in all of this. So what he did was that he tried it out. He tried it out first on his children, then on his students, and he gave the healthy people remedies and watched the toxicological symptoms. And he saw that there is a very narrow pathway to where they are toxic and to where they are healing. And so he started to dilute, to potencize, we call it in homeopathy, dilute and succuss it all the time. So the dilutions that were succussed between each dilution step, he found to produce no toxic symptoms anymore, but to produce symptoms on the healthy that showed us what kind of disease you could heal with it on the sick. So what you see here is homoios, the meaning homeopathy. Homoios means similar in Greek, pathos means suffering. So similar suffering. So what we do in homeopathy, it is a completely holistic therapy. The individual is considered as a whole, as I explained. Symptoms from body, mind, and spirit are used. The consideration of patient's environment, lifestyle are mostly important, and we provide always individualized treatment. One endometriosis case is never the same as the other. One postpartum hemorrhage case is never the same as the other. And we have to find out what is the typical thing in that case to give the right remedy to help the patient fast out of this disease. So we match a totality of symptoms, of individual symptoms, with the symptoms that a remedy can produce on a healthy person. What do we use in homeopathy? It is not just a plant therapy. We use metals that are potentized, so always diluted and succussed in between, diluted and succussed. We use minerals, we use salts, we use acids, we use animals like the bee, for instance, or the scorpion, but we also use biological substances like nosodes and sarcodes. So it's a big range. Actually, we use everything that exists in the world to potentize them to remedies that can be useful for us. Very important is, in classical homeopathy, like I am a classical homeopath, we do not use mixtures of remedies. We always use one pure remedy so that we really can understand in our patient how do the symptoms shift, how is the healing process going on, and we always know the next step when the patient returns to us, what we have to do next. If you use mixtures of homeopathic remedies, you never can be quite sure what was the remedy that helped you, what was the remedy that did not help the person, or what even was the part of in the remedy that might have harmed the person. Because also homeopathy, like each useful medicine, has also got side effects, especially if it administered in a wrong way. If you use it correctly, it has no side effects. If you use it wrongly, you produce side effects. So what do we treat? We treat pregnancy-related diseases, all kinds of pregnancy-related diseases. We treat patients in labor and delivery, with dysfunctional labor, with hemorrhage, with panic attacks, with fears, with anxiety, with lumbar pain, with everything. We use puerperal period. We use it in the puerperal period for after pain, for breastfeeding problems, for baby blues, even with great success for postnatal depressions. In gynecology, we use it in young girls with dysmenorrhea, with irregular cycles, in women with infertility, with polycystic ovarian syndrome, with endometriosis, with recurrent vulvovaginal infections that are very difficult sometimes to treat, with lichen sclerosus. We use it in the menopause, with hot flushes, vaginal dryness, insomnia, depression, fatigue. So actually there is no halt where you can use homeopathy. What I would like to show you is just one short case that you understand how what we can do with it. This is a very simple case of a perineal trauma after birth. It was a history of a 37-year-old primipara. She had a vacuum extraction, she had an episiotomia, and beside that she had a big rib, grade 3, a rupture, grade 3, a perineal rupture. The symptoms, I saw the patient, I wasn't there at the delivery, I saw her 2 days later at our ward, and she had massive perineal and vulvar pains. So severe, she wouldn't dare to touch it, she wouldn't allow us doctors to look at it, she wouldn't talk to us, she turned away to the wall and just wouldn't like to be talked to or addressed in any way. She cannot sit, she cannot walk, she was to have bowel movements was completely out of thinking of hers. Nevertheless, I was able to inspect it, and what I saw, it was severely swollen hematoma. My evaluation of a visual analog scale was out of 0 to 10, it was a 9. She doesn't allow the examination, and her self-evaluation from the pain was also a 9. In the conventional therapy, she had 3 times per day diclofenac, 100 milligram. This is quite a lot. It didn't help the swelling, it didn't help the pain. So I prescribed her just a single dose of arnica, it's a plant remedy, in a C30. This is a middle high potency. This is just to see, it was a 3 she had. Yeah, so 1, 2, 3, there you see what rib it was, plus an episiotomy. So it was quite a severe injury she had. We work with computer programs nowadays. The computer programs, the symptoms I added to the computer programs was that the lady was in no state of being addressed and that she would not allow me to touch her. I added that she had the wound that was cut with a knife, with a scalpel. I added that there was a wound with big swelling, and I added that there was a wound that was particularly painful. And then you hit the button and the computer program says, gives me different possibilities, and the highest was arnica. So, of course, I gave her arnica. The follow-up, after 1 day, she said the pain went down from 5 to 6. After 2 days, the pain was gone. This is something we cannot do with conventional medicine. It just doesn't work that fast, never ever. And the swelling went down to 1. The predominant leading symptoms for arnica was the mind symptom, that you would reject the people who could help her completely. Yeah, this is a predominant arnica symptom, we call it. And the severe swelling and the bluish-reddish hematoma. I've got another case, but I fear I haven't got the time for it anymore. So I would tell it to you maybe another time on another congress, but let me just explain you one more thing. The pros for classical homeopathy is classical homeopathy is incredibly cheap in comparison to normal conventional medicine. It is easily available treatment form. You can have it with you in your pocket. You can use it anywhere easily. Patients like to take it because it does not hurt. It is just globally, so sort of sugar lumps they eat that are where the remedy is added on top of them. They are highly efficient and they have minimal side effects if prescribed by a specialist. This little boy, you see me here at work a few hours before I hopped on the plane to come here to Istanbul. This was a little boy, and interestingly enough, it was a Turkish little boy I gave birth to. He was in breech position, and I had to do a cesarean on him. Here you see me. His parents allowed me to show you that photo because they were so happy to have their boy. He was in breech position. A woman gets from me always, if I do surgery on her, no matter what kind of surgery it is, because I treat her homeopathically. And this woman became Bellis perennis. It's actually made out of the daisy, the little flower daisy, in a higher potency than that. It was a C200. And what I see in giving the patients this remedy is that they move after 4 hours after cesarean. They get up and they walk around on their own, and they use around just a third of painkillers the women need that did not get Bellis perennis after birth. And in 15 years of doing surgery, I have had not one infection of a wound. And this is the easiest thing to do homeopathy. Just give them 5 granules after the surgery and you are done with the whole problem. And this is how homeopathy works, and this is also why my colleagues that don't know anything about the alternative medicine, they keep calling me in the night and in the day and say, Micha, tell me, I've got this and this problem by birth, by this, what can I do with the patient? Can we help her in any way? And for me, it is tremendously rewarding to be a homeopath. It is always a most interesting field to work in, and also to be a conventional doctor. I wouldn't like to be a homeopath alone or a homeopathic doctor alone. I need both of it, and I need to combine it in the most best way for our patient. Thank you very much for your patience. Hope to see you again.
Çok teşekkür ederim.